ABC7's digital town hall series, Our Chicago Voices of the Community. I'm Tanya Babich. I'm very happy to be your host for this week's town hall, and we're glad that you've joined us for another very important conversation. We hope you will find it of interest. According to the Illinois Department of Health statistics, the COVID positivity rate among Latinos is substantially higher than it is for non-Latinos. A Chicago data analysis has found that Latinos are dying of COVID-19 at a much younger age than other ethnic groups, and prevention of COVID-19 in the community is a real challenge for a number of reasons that we're going to discuss more thoroughly today. Now, I'd like to talk to you about Illinois Unidos. It was formed more than 10 months ago to help educate. And I may ask you specifically one of my questions, but if you would like to join in as well, I encourage you to do so. I know you are all more than qualified to weigh in on a number of subjects. So we will begin with Dr. Geraldine Luna. Dr. Luna, if you could wave your hand for us, please. She is the medical director with the Chicago Department of Public Health. She is the executive board director of the Medical Organization for Latino Advancement, and she specializes in internal medicine and in geriatrics as well. I'd like to get a wave from Miguel Blancarte Jr. He is our next panelist and is the director of COVID-19 response and community outreach for Esperanza Health Centers. Their 4 primary care clinics serve Chicago's southwest side. Mr. Blancarte Jr. helped to expand access to COVID testing for Chicago's Latino community, especially in the early days of the pandemic. Our third panelist is Esther Corpus. Esther, can you give me a wave, please? Hello to you. She is Chief Executive Officer at Alivio Medical Center. Alivio is a pioneer in bilingual, bicultural, and high-quality primary care, behavioral health, and wellness services, regardless of immigration status or ability to pay. We have Dr. Melissa Simon with us today as well. If I can get away from Dr. Simon, she is a professor of clinical gynecology and vice chair of research with the Department of Obstetrics and Gynecology at Northwestern University's Feinberg School of Medicine. That was a mouthful. I got it all out. And she is also the founder and director of 2 health equity organizations, an expert on women's health, minority health, and on community engagement as well. Welcome to you. And then finally, we have Dr. Marina Del Rios, if she could wave for us right now. Hello, Dr. Del Rios. She is the director of social emergency medicine and a tenured associate professor in emergency medicine at the University of Illinois at Chicago College of Medicine. She has a decade of experience in resuscitation science, population health, and health disparities. She was also the first in Illinois to receive the COVID vaccine. You are now fully vaccinated. You've had both of your doses and have had the waiting period afterwards. We are very glad for your increased immunity against this virus. I know that it was a long time that you waited for it and that others are waiting as well. So welcome to all of you. Thank you so much for being here this afternoon. Again, I encourage you to jump in. If you'd like to answer one of my questions, just give me a wave and I'll do my best to call on you in a timely manner. And I will kick things off with Dr. Del Rios. I'd like to begin with you. Tell me, how did Illinois Unidos come to be and what are the organization's goals?
Well, we came to be when we realized early on that Latinos were missing from the narrative of COVID, of the COVID pandemic and of COVID response. I think early on, our experts and government officials were overlooking the fact that we were seeing a quickly increasing rate of transmission in our communities, and with that also increasing morbidity and mortality related to that. So we're very much a grassroots organization. We came together all just word of mouth. Hey, we're going to get together and try to look at our data and see what we can do. And you know, part of the response was recognizing that data collection was incomplete at the beginning, getting information about who were the people that were getting infected, what communities they were coming from. That's not something that was consistently available from some of our departments of statistics and departments of public health. So a lot of what we did was try to do some reconnaissance, and then with that, try to leverage what assets we have in those communities that have been the hardest hit to then create a concerted response against the pandemic effects.
Did you feel as though this was a stronger together effort? That, I mean, there's so many organizations in this space that are trying to do good, that are trying to adequately serve the Latino community. Did you, I guess at some point you become exasperated though, and you try to find a way to be more powerful, to have more of an impact?
Yeah, I mean, I think that one of the strengths of this organization is that it really has been community led, right? I mean, here you're seeing health professionals sitting here, but what I think about is that we more speak alongside the community as opposed to on behalf of the community, and so really giving the voice and a space to discuss real, real meaningful solutions that work at a hyper local level, as opposed to the usually trickle down ideas that kind of happen from public health departments, from academic institutions. We really thought that it was very important that the community had a say, and that they really lead the discussion as to what works in our neighborhoods.
Miguel, at what point during the pandemic did alarms ring for you? When did you realize how vulnerable members of the Latino community were to COVID-19?
I think that's something that, from the very beginning in March, when we started seeing it in Chicago, for me, being born and raised and living in La Vita, in Little Village, um, I knew the disparities in my community. I knew that there was a lack of resources in the community. And so just knowing that this was going to be a virus, and something that was going to be on a larger scale, that the community was going to be disproportionately impacted. I think in May, when some of the data that Dr. Del Rios started mentioning started trickling in from um, the city and the state from IDPH, the numbers that we were seeing were not necessarily capturing or being very accurate, because of um, the lack of information, accurate information that was coming out. So we knew that it was going to be impacting Latinos, disproportionately so. And it wasn't until, a group of folks really started looking into this a little bit more, that we saw that there was, when the data collection, that inaccuracy in data collection was really impacting the reports itself.
I'd like to put this question out to all of you. Is there someone who has a particularly powerful, story or example of when you became truly alarmed about the state of the Latino community and the impact on the Latino community in the pandemic? Dr. Del Rios.
So my day job is emergency medicine, although I should say night job because I'm a nocturnist. But I think that when it really hit is when, we were hearing all of these reports of people dying in long-term care facilities, and rightly so, bringing attention to the significant disparities in African American deaths, right? But what I was seeing practicing at UI Health, which is a hospital that serves a predominantly Latino community in Pilsen, Little Village, and sort of the near west side of Chicago, was what I was seeing coming through my doors is a lot of people that looked like my uncles and aunts, like my mom, and I remember having this tweet storm with a couple of colleagues, realizing, well, what the heck is happening with the Latino community? Like, every person that I admitted last night to the ICU was Latino. And that was really when it struck me. It's like, it's not just me, it's happening all over the city. And then, of course, I think for a lot of us, this has been very personal. We've lost friends, family members. We've heard of people that have died in our community that were close to us, that were leaders in our community. And so I think all of that early on was really what brought this group together, the fact that this was personal to a lot of us.
Esther, what did the early days of the pandemic look like at Alivio Medical Centers?
Yeah, I was going to say, our biggest population is our immigrant population at Alivio. More than 60% of our patients are undocumented. And so they've always had, issues with access to care. And so early on in the pandemic, we saw that there wasn't a lot of testing targeted specifically for the Latino community. And it's almost like the vaccines right now, where people are scrambling to try to get get that shot, it was the same for COVID testing. And so what we were seeing is, inadequate testing, but also when they were getting tested, the rate of positivity was just, so much higher than any other group. And as Dr. Del Rio said, the data that was being reported did not support what we were seeing at the community level. And then just seeing the spread, because we know that our population, live in more confined, apartments, and essential workers, having to go to work sick. And so that spread, it was just, disproportionately high, and continues to be that way today. I mean, we have, so sorry, we have, done better at testing, but we're still not where we need to be. And even though our numbers have gone down, there's still a need for increased testing, and certainly for vaccines.
Miguel, I'd like to go back to you now on the subject of testing. And one of the messages that is really important that people take away from this town hall is the continued need for testing. We must continue to be vigilant.
Yes, testing is really a way of helping contain the virus itself, right? If you know that you have COVID, then you want to take the necessary steps to prevent the spread of the virus to others, to your family, to your friends, and just to anyone else. So the importance of testing is still very much relevant. And, on a citywide scale, we have seen numbers. At Esperanza, we started testing back in March of last year. We were one of the first sites to be able to offer testing in the southwest side of Chicago, and we continue to offer, including now in Marquette Park, inside Marquette Park, and testing itself is really critical, right? Because we don't have a vaccine for everyone quite yet, and in the meantime, we need to contain the spread, especially given the new variants of the virus itself. Which are dangerous, and it's making this pandemic a little bit more dangerous in that sense that it's becoming a little bit easier to spread. And because folks are not necessarily testing at the same rates that they were maybe even a month ago, 2 months ago, we need to ensure that people are still coming out to get tested.
Let's touch a little bit on the vaccine itself and its perception in the Latino community. Dr. Simon, I'd like to come to you and ask you about some of the myths that are circulating, some of the misinformation, and why that's so detrimental.
No, thank you. So first and foremost, this vaccine has been tested. The two that are approved, there's two, right? The Pfizer and Moderna. And they have been tested on thousands of people, both Latinx, Latino, and also Black and white populations. And in our country, yes, there have been testing sites outside of this country of the United States, but in our country as well, this vaccine has been tested and has gone through a very rigorous process to ensure safety and efficacy. And that is super important. And even now, after the approval, many of us, including a few of us on this town hall right now, myself and Dr. Del Rios, who have received both doses of our vaccine and are well away, more than 2 weeks away now from having had that second vaccine. So that's first and foremost. There are a lot of other myths. When you get injected, it is not a DNA. It doesn't go into your DNA. It doesn't change your DNA and who you are. There's no tracking device in the vaccine. It is based on solid science, and really vaccines work. And it's really the only way we're going to move forward from this pandemic and go back to normal, or whatever new normal will be, is to actually get almost 80% of our entire planet vaccinated. So 80% of Chicago, 80% of entire Illinois, 80% of the United States, 80% of the entire planet, before we can say we have enough immunity and we can move on. And that is a tall order. And so whatever we have to do, whatever information you need to be able to make that decision for yourself to get the vaccine, that's really important.
No pressure. 80% of the world, no pressure at all. Dr.
It's a
Luna,
lot.
how
Oh,
Dr. Luna, how do we get the message out?
Yeah, that has been very challenging because trusted faces in the community is not something that it's easy. And that breakthrough, it's something that in Latino population, we are who we are. We're made for resilient. We have learned our survival methods, especially because all these failing systems that we have in place. And we were not part of even part of the creation of maybe the Constitution. They didn't see us. People like us were not part of the initial plan. So passing the message, creating trust, inviting people to trust systems that have failed them in the past, and science and what we have there to rely on, it's very difficult. And when we're reaching out to communities and telling them this vaccine will save you, but the other science projects done in the past that had inflicted so much pain to entire population, not only in Latina but in African American, is very difficult to pass that word alone. So having champions like, for example, Dr. Del Rios, she was the first Latino getting it. Now Melissa promoting getting their vaccines is a strong way to go, but there is a long way to go. There's a lot of ground to cover in when our population will feel comfortable. We had our healthcare workers refusing the vaccine. Only up to 70% of Latino nowadays have been vaccinated when offered. So we're talking about 100 people were offered the vaccine. Only 17 people decided to get it. And those are very alarming numbers when we compare to the rest of the population, that 190 people or in 100 people, 90 go there and get their vaccine. So those are powerful numbers. And it tells us a story that we need to address this issue. We need to be more represented. Our voices need to be up there so that people feel comfortable knowing that we're represented up there. Otherwise, they will never trust their systems because there's not people like us sitting there at the table doing those, making those policies that will affect us and impact us all.
You can understand how the misinformation would circulate and why it would, why it would take hold in the community. Dr. Simon, you talk about people worrying that there's some kind of tracking in the vaccine. When Esther, you talk about 60% of the patients that you serve at Alivio medical centers being undocumented. So, Dr. Luna, you've talked about this kind of at a macro level, people like yourselves being represented at higher levels of administration and government and leadership. How do we change hearts in our own homes? Who'd like to jump in here?
I can jump.
Dr. Simon, I'll start with you.
I think we keep asking, please keep asking questions and get answers from us, your community leaders, your doctors, everybody. We get the information. If you don't have a satisfactory answer, keep asking it, because there are some good information sources out there. And Illinois Unidos, for example, has a lot of good information, both in English and in Spanish, on the websites and in forms of many town halls. There are trusted community clinics like Esperanza and Alivio and others across the city. And you can go ask questions, and it's okay to not get to a yes yet. It's okay to still think about it. Because this is a process, and it's not going to be just because I, who am Mexicana, got the vaccine, so you should too, or Dr. Del Rios got the vaccine, so you all should too. So I think that's part of it, is that it's for some people, it's going to take time, and that's okay to get to a yes, but we want us all to get to a yes.
Esther, did you want to weigh in as well?
Yeah, I agree with what Dr. Simon said. And I tend to, every single time I go to the grocery store, and I ask the person at the checkout, have you gotten vaccinated? Do you want to get vaccinated? And even as early as yesterday, I talked to a Latina that was checking me out at Trader Joe's, and she said no, she does not want to get the vaccine. I asked her why. And it's like a wait and see sort of attitude. So I think all of us, have to play a role in trying to educate the public. We're using our community health workers at the grassroots level, along with our entire healthcare team. But they're trusted messengers that have been around for a long time at Alivio. Since day one, we've had community health workers in our practice. And so they're holding like little mini coffees online with smaller groups so that these patients can ask the questions and have that opportunity rather than a huge Zoom meeting where people feel like they don't want to ask a question, doing smaller gatherings. But I think it's going to take all of us, to talk to everybody that we come in contact with and ask them and listen to what they're saying. Because there is, and we see it more in the age group of like 20 to 40. The seniors seem to be like right now we're starting to do 65 plus. They're very anxious. I mean, we have a huge waiting list for our 65 plus patients. They seem to be, very interested and anxious and willing to get vaccinated, which is wonderful. And hopefully maybe then their grandchildren will get vaccinated. So, right.
Dr. Luna, I'd like to come to you next. And, we have these waiting lists of people, especially the elderly, who are anxious, who are willing to get the vaccine. This question comes to us from Janine. She says, well, why has Illinois administered only half of the vaccines that it has?
Illinois has actually, we have allocated 95, and 5% has been for the pods and for CDPHUs with strike teams and different modalities that we have. And we're implementing now that we're moving to this big group on behalf of the city. But all of those vaccines have gone into arms right now, and there's more to come. The only limiting factor here,
I'm sorry. I just pulled up the vaccine statistics that came back to us from the Illinois Department of Health today, and it says that 46.4% of doses assigned to Illinois have been administered. So are the other ones in storage? Are they waiting to be administered as second doses? How does that work?
Okay, so from what is allocated to Chicago, like for example, I can tell you a little bit about Chicago, and I'm not the expert on this one, but I can tell a little bit more about that. Is that everything that has been allocated, which is pretty much 32,000 per week, that's pretty much what we're getting. We start at 68, and little by little it has trickled down because of the scarcity, because it's still, very limited supply. But it's good news is more coming in February. It seems like it's going to be a great month here in Chicago. But everything goes directly into our facilities, our healthcare systems, they go out to residents now. Our pharmacies are partnering. And now we're calling bigger at a bigger scale that we're moving to vaccinate 600,000. And it's maybe a lot of data, and that's unfortunate because we rely a lot on whatever is our health system is putting in the system and collecting and retrieving that data to give us exact numbers. And that doesn't happen as quickly as we would want to keep a transparency. So the city, like everybody can feel reassured, look, it's happening, it's coming. So, but as it is coming in, it's going directly into arms, and there's no really supply. Like, I don't want people to think that there is a little corner or a little, place, a storage place that they can get all those vaccines that somebody is stashing, because it's not the case. Everything is going out so far.
Did anyone else? I know there were some hands raised earlier. We'll move on from there. Another question that we got from Maria has to do with American seniors and Latino seniors falling through the cracks. A lot of them don't have computers. They can't schedule appointments. Not to mention, even if you do have a computer, it's nearly impossible to find an appointment right now. I know from my own experience, my nana, my abuela, she can't advocate for herself. I mean, there's a language barrier there as well. And so how do we make sure that we communicate the needs, especially of our elderly community, especially of those, whose primary language is not English or who can't communicate in English easily? How do we advocate for people like our grandmothers and our grandfathers? Miguel, I'll start with you. Everybody wants to answer this one. Abuela and abuelo need to be taken care of.
Yeah, they really do, because they really are one of the most vulnerable populations, right? They tend to have pre-existing conditions, and I think what's important here is the direct communication with them. I know for us, we as soon as those that were 65 and older became eligible to receive the vaccine itself, we started actively looking into our patient database and reaching out to them, making the phone calls, involving our staff in the call center and our contact tracers as well, and scheduling them in for an appointment. And very interesting, because we had done a survey of our patients prior to, and I received the results quite literally the day before we were going to be making these phone calls. We surveyed over 2,000 individuals from our database. Those that identify as Spanish speakers and English speakers as well. And from the 65 and older population, we asked the question: if the vaccine were offered to you today, how likely is it that you would get it? 94% of those whose primary language is Spanish, who are 65 and older, said that they would receive it. The following day, we were already scheduled to start making these phone calls. So I think it's having that interaction over the phone. Yes, we use social media as well, and that's great. But at the same time, we do know that a lot of the communication for our older folks, even just generally for the Latino population, we don't have, because of the lack of resources that I mentioned earlier, one of them not being access to internet at home, we recognize that. So making the phone calls is really important. On the prior question too that you had mentioned about how do we really reach out to and inform our population, I think it's our Latino community is making sure that the information that we are communicating is communicated in a manner that is comprehended by folks, right? Because there's a lot of data and information, and I think it's our responsibility to make sure that we're communicating the right information and doing so in a discernible manner that folks are going to be able to understand. That my parents can understand, that my family members, and that just everyone can definitely get on board with. And I think those are things that are very important.
Who's up next? I had a screen full of hands before. Is there anyone else who'd like to add something else?
Yeah,
Esther, we'll go to you.
I'll just add, we're doing very same system of outbound calling our patients that currently go to Alivio. We also have Casa Maravilla, which is our senior center. And so we have tomorrow and Saturday and next week are vaccinating everybody at Casa Maravilla, but using Casa Maravilla as being that senior center, that not only the residents of Casa Maravilla use the facilities, but the community, the greater community, sees the senior center as a safe place for seniors. And we're also reaching out to their emergency contacts to say to them, if your abuela doesn't have a smartphone, we will help make that appointment for you. And in many cases, they are the ones that are reaching out to us. It's the family members who want to get their grandmother or their parents vaccinated. Susana Mendoza is bringing her 80-something plus mom to Casa Maravilla on Saturday. And she was very emotional when she told me, I'm so excited her brother, and I don't think it's a secret, her brother almost died of COVID and was in the hospital for 2 months. So for her, it was a very personal thing. And to have her mom vaccinated, and this is the story. We all love our elderly, right? And to get them vaccinated is, it's like a gift. And so we look forward to this next phase that we're in right now, this 1B, because these are individuals who want the vaccine, who are embracing it. And I'm hoping that with their enthusiasm, it will spread to the younger population who maybe have some resistance right now.
This is Dr. Luna, please. Oh, can you turn on your microphone, please?
Oh my God, I don't know why it go automatically to mute. So right now, this is so important question, because this is where Illinois Unido takes the lead. We have working as Illinois Unido. It's very weird, my position, because I'm also part of the city, but it interesting in a way, because we are sitting down, Illinois Unidos is sitting with the city And we're coming with these amazing tactics, like, for example, to break through and make sure that we have linguistic and cultural concordancy with our population. And we have now Chicago Protect, moving now to Chicago Protect Plus, where all the languages, door to door, knocking on the doors, promotoras coming for education, which Esther has a lot to do with that. And also Esperanza, healthcare has a lot to do with that. And then we're having phone banks, and we're making sure texting in Spanish, making sure that all the language is there in a concordant way. And now we're doing a lot of publicity, and there's where Illinois Unidos is sitting down again, taking the vanguard in helping us go out there, make sure the connections with the community, town halls, education at a massive scale. Now this right now this platform with you is thanks to Illinois Unidos, is another way to tell our patients and our members out there in the community, vaccines are safe, they save lives. And over, that's the message that we want to convey. And that it's safe, it hasn't cut corners. We're doing it. We're Latinos. We're, really reinforcing and making sure that all the data is out there for you so you can make informed decisions. And there's a lot more ground to cover. But we're sitting down at the table with the mayor and having these conversations. We're sitting down with the governor, Governor Pritzker, having these conversations with Dr. Isiki, because this is a matter of public health. It's a matter at a bigger scale. And that's what we really came in here to play. There were failing systems, and we want to make sure that we're bridging those gaps, and that none of our vulnerable population is staying out of the narrative, as Dr. Marina mentioned earlier today.
Dr. Del Rios, I'm sure a lot of people are watching us right now and saying to themselves, okay, I'm sold, sign me up, but I can't sign up. How do I sign up? I mean, how do we help people to better understand how they can get access to the vaccine and at what point they qualify for it?
Yeah, and the system is imperfect, so I want people to manage expectations. But I think your best bet is if you have a medical home, start there. Start with your primary care provider. That is the easiest way of getting an appointment, accessing the vaccine. I do recognize that there's a large proportion of the population that may not have a primary care provider, doesn't have insurance. And so this is where the city pods play a role. And maybe Dr. Luna can speak a little bit more as to how to sign up for those. But this is a reason too why Illinois Unidos has been advocating to think about a delivery system for vaccines that is outside of the traditional medical homes. And we really need to think about mechanisms to deliver vaccine education, but also the vaccines themselves, where people live, congregate, and work. And so I think that this recent announcement by Mayor Lightfoot in focusing in communities that are at high risk is a step in the right direction of going to these communities that have had the highest rates of infection and mortality from COVID, starting there, and maybe skipping the phases a little bit in those communities with the interest of getting as many people protected in those communities as possible. I think is the right way to go. Now, the question is how we make that work on a day-to-day basis. And certainly the pods are an answer, but we really need to think about also partnerships outside of just traditional medical homes to get that happening.
Any other contributors there? I'd like to, this is when we talk about, our elderly population, our family members, and a lot of the stressors that have been, in everybody's lives, and especially in the Latino community's lives. I think ahead to a time when my family is finally vaccinated, when I can be vaccinated. Next week will mark 1 year since I lost all my parents, my grandmothers, and my siblings. I have the added challenge of having a border between us that is presently closed. But we are very loving, tactile, hugging, kissing people. And so what does this world look like once our loved ones are vaccinated? What kinds of CDC measures are still necessary to protect people, and what does life as usual look like in this post-vaccination, I can't say post-pandemic, but post-vaccination world? Dr. Simon, you're nodding, and I see you smiling and nodding. I think you understand what I'm saying here.
Yeah. Well, even if you get the vaccine, we still have to wear the masks. We still have to do the physical distancing and washing the hands and hygiene until we have more data. Okay, we are building a jet plane or a rocket ship while it is flying, right? And it's the only way we can do this is get people vaccinated. But while people are getting vaccinated, all these companies and the scientists are actually continuing to study the vaccine. And so there's the people who've been participating in the clinical trials remain in the trials for something called phase 4. And what that means is that these trials will continue to follow people and look at what their immune system is doing with respect to antibodies, your army. So when you get the vaccine, your body has the natural army, all right, and it builds. And every time you get exposed to coronavirus, your army will go, hey, that's an offender, that's the enemy, attack. And we need to know if that army stays alert and ready to attack coronavirus for a long time, or does it mean that we need a booster every year, just like we do for the flu shot, right? Every year you need a flu shot. So those studies are underway right now, but so we don't know when we'll not have to wear a mask and not have to physical distance. But for now, we need people vaccinated so that we can at least control the spread and also control the number of variants, of varieties, because this virus is smart. It knows how to duck and hide and mask itself and create new strains, new variants that are actually more contagious, more deadly, and those things are dangerous. So when we get that 80% I talked about, most people on this planet vaccinated, we actually quell that virus's ability to mutate, to disguise itself. So those are all really important points, hopefully, that answer your question.
I still want to hug and kiss everybody, but yes.
Actually, there's one more point, actually. As these studies go on, they are actually starting to enroll younger people and people who are pregnant, lactating. 12-year-olds to 16-year-olds are now being enrolled. 12 to 18-year-olds, are being enrolled in the Moderna study. 12 to 16 are now being enrolled in the Pfizer study. So slowly, inch by inch, we're going to expand the number of populations whom for the safety and efficacy of the vaccine.
Miguel?
Yeah, I remember Dr. Fauci last year joking around and saying, hopefully we don't have to shake hands after this. I've seen memes of folks saying, I can't believe I let you breathe on me prior to this mask. Which is great that people are, making light out of this, right? And I think moving forward, though, one of the silver underlinings of this, one of the things that post-vaccination that I hope folks are really attuned to is their health and the importance of their health, especially our community, especially the Latino community. We tend to leave health, lo dejamos a la desidia, right? We say, yeah, sure, well, I'll go to the doctor at some point. But we really don't focus on making sure that we do go every year, at least every year, a couple times a year. And we really don't focus on our health. We're really more reactive as opposed to really preparing ourselves and making sure that we're not susceptible, or we prevent as much as possible these chronic conditions, right? So being more attuned to our bodies and our own health and our family's health as well. I really hope that is something that we get out of this, that individuals, know that have a doctor, PCP, a clinic, a hospital that they can go to, that they would continue going to for at least a year. Because one of the most important things in life really is our health. And I think that this pandemic has really shed a whole lot of light into that.
Yeah, and Esther, I'm sure you can speak to that as well. This notion, and we've talked about this. It's not just in the Latino community. We've talked about it extensively. How Black men and women have better medical outcomes when they are treated by doctors who look like them. There's a greater trust and a reciprocal trust there. And Esther, I'm sure you can speak to that as well at Alivio.
Yes, no, for sure. I mean, we require all of our providers to be bilingual and bicultural, and it really does make a difference. Many of our providers, were born and raised in Pilsen, little village, and in communities that we serve. And it certainly does. And we have DACA. We've had some undocumented providers on our team. And, you know, when they go into a room and, you know, a patient shares that, you know, they're depressed, they're worried about deportation, and my provider can say, I'm DACA, I could be deported too. This was before, you know, DACA was protected. It makes a huge difference to be able to relate in a very personal way with our providers. I agree with Miguel. Hopefully, you know, people will look at their health, you know, in a much more meaningful way, that it's top of mind for them. Preventative care, which is something that we encourage our patients not to wait until they're sick or wait till they're on their last med to come and see us. The concerns I also have is the long-lasting effects that COVID has on your health, on, you know, your lungs, your kidneys. And I also worry about, and I like to mention this because we sometimes have patients that are putting off their routine pap smears and mammograms. And it's safe to have your pap smear, to come in and have your mammogram. So don't put off those preventative measures just because of COVID, because I fear that, you know, are we missing some of these, you know, diseases by not getting those annual visits, annual checkups.
I'd like to pause for a moment to address some of the questions that are coming in for us on Facebook, specifically that relate to the vaccine and the safety of the vaccine. Several of the questions that have come in have asked about allergic reactions to the vaccine, severe allergic reactions to the vaccine. Are there any deaths attributable to the vaccine? These are some of the, you know, these are some of the stories, you know, information or misinformation that gets circulated and that make people afraid, you know, to take that step and to get the vaccine, or take the wait and see approach. Dr. Del Rios, what do you say to those people who are watching right now, who are concerned about whether, you know, they might have a reaction to the vaccine, or if they are thinking about helping an elderly person in their family to receive it, they want to be reassured that nothing worse than the virus itself is going to befall their loved one?
They're all valid questions, right? And I think that those are very important questions to ask and important conversations to have with your medical provider. I mean, look, with side effects from the vaccine, a lot of them are very similar to other vaccines: local swelling and pain from the injection site. Because you are going to expect your immune system to have a response. It's expected to maybe the day after have some body aches, some fevers. Maybe you'll be more tired, a little bit of a headache. You know, I myself didn't have as bad reactions. I mean, the most I can report is the day after I felt a little bit tired, had some headache when I went with the Tylenol. I do have colleagues of mine that were actually out cold for the day and just had to rest and let their body recover. But again, this is not unlike what other vaccines do. I mean, think about when you take your kids to get their shots, oftentimes they develop a fever a day or two. That's expected, right? As far as allergic reactions, I think if people have had allergic reactions to previous vaccines, they should have a conversation with their physician about how to get these vaccines done in a safe way. They may need to be observed for a little bit longer immediately after the shot. Sometimes we have to give some preventive medication to prevent severe allergic reactions from happening. I know that out of the tens of thousands of vaccines that have been distributed, hundreds of thousands by now, I think the latest count was maybe 11 hospitalizations for, quote, severe reactions, which were allergic reactions. No one has died, as far as I know. Please correct me, my colleagues, if I'm missing any reports, but the latest reports I have seen is that no one has died as a result of the COVID vaccine. Going to the COVID disease, you know, 1 in 100 people who get COVID end up in the hospital. And that is not age adjusted. When you consider for the elderly people over 65, 30% end up hospitalized. And the mortality rates are much higher, meaning that people actually die from COVID, and in pretty big numbers, and especially in the Black and Latino communities that we serve. We are seeing, I've never seen this many people die in my emergency department. I don't ever want to have to live through this again. It's been very painful to see so many people dying from something that is potentially preventable with good public health measures. And now with this vaccine, we actually have a way of preventing our population from dying and from losing so many people, too many lives cut too short by just getting our community vaccinated.
I'd like to ask you all, as we set our priorities beyond COVID-19, obviously we're focused, we are laser focused on maintaining CDC guidelines, on getting as many people vaccinated as possible, but we also have to look at the world beyond this period of time. What should local governments, nonprofits, advocacy groups prioritize going forward to alleviate some of the underlying inequities that made COVID-19 so deadly for the Latino community? Dr. Luna?
Yes, I think there has to be changes in policy. This frail populations or vulnerable populations and our ethnicities per se, we can't. There's not one all size fits all. Like for example, linguistic cultural competencies when you're attending members of your community or patients in your community. When you think about the communications, when it's coming from the high level and expanding to everybody else. And when we're thinking about initiatives and interventions to prevent, I mean, COVID was an eye opener. Like what we're seeing right now is it's the ripple effect of systems, decades of systemic racism and discrimination, and we really have to work to change those investment in communities, more more interventions, more policies to protect populations, minority groups in this country. So I think that is an important point that came out of all this devastation, and it could happen again. There's no guarantee that we'll not see a second pandemic, namely COVID or another one coming our way. So this is a wake up call for all the government, for federal government, that we need to strengthen our foundations. We need to start building from the ground up and taking into account populations like ours, which has been the most highly hit, devastated. 15,000, 1,500, I'm sorry, Latinos alone have died in Chicago. So this is a big number, and where we're talking about, like a time frame, so small time frame from the pandemic itself. So, and I'll open it to the panel if anybody wants to jump in.
Miguel, why don't you go next?
Yeah, I think this is a time to really reimagine a lot of our systems, right? I think this is something that we had already been really trying to do over the last couple of years, I think. But really, it's time to bring in and incorporate that equity into different policies and laws that were set by individuals that didn't look like myself, that didn't look like any one of us, right? That essentially were white men, and these policies had been established and where the law were set. I think what we've seen, and I'm grateful that the new president, President Biden, mentioned this, that it's really about addressing structural racism. Because when we don't have equitable policies, when we don't have equitable systems that are really going to get to the core of this, whether it's one area that impacts our life or even health, for example, right? Unless we address these systems and we navigate, we start steering them to different directions, where they do incorporate different individuals, the way different individuals speak, how information is communicated to these folks. I think that's extremely important in addressing equity. We knew about justice and fairness, right? And there's the new concept of not new, but equity itself has been around for a couple more years in the limelight. And we used to address justice, fairness, but really it's about making systems equitable.
Dr. Del Rios?
I mean, I think that one thing that we have come to understand as a society as a whole, I think some of us already knew this because we've been doing this work for a while, is the fact that health justice does not exist in a vacuum, and it really has to go hand in hand with social justice. And so as we think of increasing access to healthcare, we also need to increase access to living wages so that people can actually take time off if they get sick. We have to have access to good education for everyone in our community so that we can have more voices like the people on this panel be able to have positions of power because they've gone through the educational system so that they can get to these positions of power. And I think that ultimately what really the message in all of this has to be that we do this out of solidarity and not charity, because in the end, we're only as healthy as the most marginalized among us.
Dr. Simon, Esther, is there anything you'd like to add there?
We are super connected. And, even when the most disadvantaged groups get lifted, it actually lifts the health and the well-being of those who are more advantaged even higher. So we really do have to invest in everyone and invest in the fact that we are humans, and that is our commonality across the entire planet.
Esther?
And as devastating as this pandemic has been, it has brought groups together like Illinois Unidos. I think we thought it would be a temporary thing, but I don't think it will be. And it shouldn't be, because, it's a fluid situation and we have to invest in our future. And it's going to take, really everyone that, we say we're all in this together, and that might be, a coined phrase, but it is true. It takes every single one of us at different levels of government and in the community to figure out, how, we can be better as a society and be, socially just with everything, as Dr. Del Rios said, investing in our children so that we have, more Dr. Del Rios and more Dr. Lunas and Dr. Simons and more Miguels, more Tanyas. I mean, we need folks in the media. You bring the message to the community, and our media partners are extremely important to us as well.
Thank you. I think it's important also to recognize that with the work that you've done with Illinois Unidos and in your respective jobs and facilities and organizations, it's important to recognize what you feel as though you've been successful in. I think we've come a long way from where we were in the early days of the pandemic. Were you surprised by anything along the way pleasantly at any point? I know it's hard to think of the big picture when so much of it is so very difficult on so many levels. Dr. Luna. Your microphone, please.
Oh my God, I always go into mute. So I think that after coming together in this coalition, what has surprised me the most is how much we have accomplished as a group. Individually, we would have never had the opportunities to sit down, to be part of the decision, to make changes that impacts the whole population, especially Latino population. So sitting together, it's incredible the power that the group gives you in sitting down and addressing issues, that it's for a common good. I mean, social determinants of health clearly is not working for us. You don't even need now to cross the street to see that life expectancy changes 30 years. Just sit down and wait for COVID to happen. And it proves that it takes the life away of all Latinos and pretty much cleaning us up from the planet if we don't do something to make those changes. And this group has been amazing every since the coalition has come into place. And thank you, Xavier, if you're listening to us, and Cesar Rolón. They came with the idea, they put us together, and it's been amazing how much we have accomplished as a group, as a coalition, in terms of changes in health. And we're moving more to make it changes in policy as a whole.
Esther, you had raised your hand earlier.
Yeah, no, I just, it has been a very difficult period for all of us, on this panel and for the community, and to have, that fellowship among, everyone on this panel and the 100 and so people that are part of Illinois Unidos, you don't feel like you're alone, and that has been, I think, very important for all of us, because they're long days. I just can't believe it's been a year. I mean, But, I think it's important for our future that, that we have this group now that, is very strong and very focused on, as we talked about, making those policy changes, which will have a long-lasting effect, for us in the community.
Any other parting words from any of you? We're running out of time now. We're coming up on that 3 o'clock hour. Dr. Simon.
And it's been a sincere pleasure and privilege to be able to watch the interaction of our very extensive cross-sectoral group, the collective power of the nosotros, of the we, with the mayor's office, with the governor's office, with we have over 30 elected officials who have joined Illinois Unidos. So that has been very wonderful and welcoming, and I think a sign that better days and better policies and work is coming with the health equity justice framework.
Tanya, I just want to add very quickly that it's amazing. I don't know if my colleagues here feel the same, my partners, and taking data, because that was a problem initially, the collection of data, moving data into action, and see how this group is a representation of community mobilization and empowerment is off the charts. I find it so incredible. I'm so blessed to be working with this amazing group, and I hope to see the fruits, because there's a lot that it's coming our way, and it's positive for sure.
We got one last word.
Yeah, on a personal level, I didn't know Dr. Del Rios, Dr. Simon, Esther, Dr. Luna prior to Illinois Unidos. Illinois Unidos brought us together to address this pandemic. And I feel so fortunate to now call them not only colleagues, but familia, friends that, we reach out to one another. I know a couple of you folks mentioned, we've talked about after this pandemic, having you over, and, getting together for conversation. And I really, the resiliency of the Latino community, not only us as, kind of helping lead, but the Latino community and just humans in general, acknowledging individuals that they probably didn't prior to, seeing how, New Life is out there doing food pantries and different organizations working together with one another to really feed our community, protect our community as much as possible. That has been inspiring. And I hope that's also something that doesn't change moving forward.
I am so proud to be with you all here today. We all know from our own experiences and from our own circles and now the extended circles that we've created for ourselves, how much representation matters. Dr. Del Rios, you have 30 seconds. Go ahead.
Just a quick thing. I think one thing that this group has done for, at least for all, I feel that for all of us, is that in the absence of physical connection, this social connection is really what's kept us sane in the last year. And so what I hope is that other people take that as a message that although we may be physically distanced, there is opportunity for social connections. And yeah, I mean, there's a community out there that is there for you. We're family.
Well, I want to thank all of you for your time today. Thank you all so much for your expertise and your wisdom and your advocacy. We appreciate all that you are doing to educate the Latino community outside of your day jobs as well, which are busy in and of themselves. You make us all Chicago proud, and you remind us of the essential work that we must all take part in collectively to take care of each other, and especially those who are most vulnerable. Thank you all for being here today. We appreciate you. It's great to connect with you in this way, and someday we'll be able to give all the hugs that we want. For all of you who are watching today at home as well, thank you for joining us. Stay healthy, stay safe, and have a good rest of your day.